Hello and welcome. In this lesson, we will explore the proactive roles that your manager parts fill. My hope for you is that you have already watched the IFS overview and are familiar with the definition of a manager. This is a long video lesson, and there is a ton of valuable information in here, even if you can't identify having one type of manager. If you keep watching the video, you might be able to identify another type of manager. There may be certain managers I discuss that trigger feelings that seem familiar, and you might realize you have a manager part you didn't know you had. We'll be discussing the concepts of IFS managers, and that may be able to help you develop a new perspective on your inner psyche, psychology, and personality. First, I'm ethically obligated to inform you that this video's content is the creation of me, James Fitzgerald. It is my own personal perspective and professional interpretation of the main ideas underlying IFS therapy. The information in this video is for educational purposes only, to provide detailed examples of IFS concepts. Please be informed the content of the video contains discussion of suicide or self-harming behavior. Please proceed with caution. Before we get into our lesson on managers, let's just quickly review the main ideas of internal family systems theory. Internal family systems, also referred to as IFS, is a therapeutic model that was developed by Dr. Richard C. Schwartz in the 1980s. It is based on the idea that the human mind is naturally made up of multiple subpersonalities or parts, each of which serves different functions within an individual's internal system. The individual's internal system is also known as the psyche. The psyche is the totality of the human mind, including both conscious and unconscious components. It is the center of thought, feeling, and motivation, and it directs the body's reactions to its environment. The word psyche is a fundamental concept in psychology and philosophy, and has been used since ancient times. Rather than viewing a person as having a single monolithic personality, IFS recognizes the mind as having various parts that work together in a complex system. These parts can take on different roles depending on an individual's capacity, life experiences, traumas, and needs. IFS therapy seeks to help people understand, communicate with, and heal their parts, leading to more harmonious internal functioning. A core principle of IFS is that at the center of every person there is a true and best self, a calm, wise, compassionate, and undamaged aspect of the person that can act as a leader for their internal system. The goal of IFS is to help people connect with their self and guide their parts toward balance and healing. There are three main types of parts in IFS. The first type of parts are the exiles. The exiled parts carry the burden of pain, shame, fear, or trauma from past experiences. They are often suppressed or exiled because their emotional intensity is difficult for the person's internal system to handle. When exiles are activated by internal or external events, they can cause distress or overwhelming emotions. The next type of parts are the managers. The managers are the proactive parts of the system that try to maintain control over the internal system by keeping the person functional and safe. Managers may work hard to prevent the exile's pain from surfacing by avoiding triggering situations or suppressing certain emotions. The last parts of the system are the firefighters. The firefighters are the reactive parts of the system that jump in when exiles' emotions are triggered. Firefighters often engage in impulsive or distracting behaviors such as substance use, overeating, or self-harm to quickly numb the distress caused by the exiles. IFS posits that underneath all the parts and separate from the parts is a person's true and conscious self. The self is the healing agent in IFS therapy as it embodies qualities like curiosity, calmness, compassion, and clarity. The self can help the various parts communicate, negotiate their roles, and unburden the exiles. Once parts feel understood and appreciated for their roles, they tend to relax, allowing the person to engage with life in a more integrated and centered way. Before I talk about each of the different types of manager roles, let me share some basic information about managers. The basic function of all manager parts is proactive planning and protection. Their main goal is to prevent emotional pain or discomfort by controlling how the individual interacts with the external world and their internal experiences. They work diligently to keep vulnerable parts of the individual system, known as exiles, from surfacing. Exiles carry the heavy burdens of trauma, shame, fear, or other painful emotions. Managers strive to maintain balance and functioning in daily life. They aim to ensure that the individual can navigate the world without being overwhelmed by negative emotions. The internal managers live in fear of the exiles escaping and will try to avoid any interactions or situations that might activate an exile's attempt to break out or leak feelings, sensations, or memories into one's conscious awareness. Now I'm going to move on to start talking about the different strategies the manager parts adopt and how they are forced into roles they do not enjoy but believe are necessary. The primary purpose of all managers is to keep the exiles captive in the subconscious, both for the protection of the exiles themselves and the protection of the system from them, keeping the feared feelings and thoughts from spilling over the inner walls, so that your system remains safe and able to function in your life. They act proactively to prevent the activation of exiles by keeping you in control or out of danger, away from unknown circumstances or unpredictable situations at all times. They act proactively by pleasing and taking care of the people you depend on, so they will like you and stay in your life. I am also going to complicate this idea even further in noting that managers are often polarized with firefighters and will ask for the aid of other managers to prevent a crisis. Managers can and will form partnerships with other managers, and they will ally in groups and coalitions of managers to achieve their goals and intentions. Now I will move on to the next part of the lesson. Let's take a brief peek at some of the more common characteristics of manager parts. In what seems outwardly like controlling behavior, managers often seek to manage situations, emotions, and behaviors to avoid triggering exiled parts. They may appear as perfectionistic behaviors. Some manager parts push for high standards and perfection to prevent ridicule, humiliation, criticism, or failure. Some will be experienced as a critical inner voice. They may manifest as self-doubt, inadequacy, insecurity, self-criticism, and an avoidance of vulnerability to preempt external criticism or rejection. They may make us feel anxious and be worried about anything or everything, constantly scanning for potential threats to emotional security, safety, and stability. In what may seem to others as passive, submissive, and fawning, the people-pleasing managers are constantly striving to meet others' expectations to avoid conflict or disapproval. Managers can also display rigid or inflexible thinking, also known as all-or-nothing thought patterns, adhering strictly to routines or rules to maintain a sense of control and emotional safety. In order to maintain this kind of internal and external control, some managers can project the outward appearance and substance of success, providing you with the drive and focus to gain impressive academic, career, or monetary achievements. Success not only brings control over relationships and choices, but also can serve to distract from or compensate for your inner shame, fear, sadness, or despair. If you are dominated by a passive pessimist, dependent one, or worrier, your life may be characterized by a series of half-hearted attempts and failures, which provide you with protection from responsibility or disappointment. Other common managerial tools or manifestations include obsessions, compulsions, reclusiveness, passivity, emotional detachment and sense of unreality, phobias, panic attacks, somatic complaints, depressive episodes, hyper-alertness, and nightmares. The rigidity and severity of these various managerial strategies will match the degree to which the managers think, correctly or not, that you are in danger of being re-injured. Contributing to their rigidity and extremeness is the fact that they have more responsibility than they are equipped to handle. They not only have to deal with what they perceive as a dangerous outside world, they are plugging the leak in the dam that contains the exiles, and are desperate to protect the self from these internal and external threats. In this position, managers are neglected, suffering, and scared, like parentified children in a dysfunctional family. When you finally get to know the managers in your inner system, parts that are approval-seeking, striving, perfectionistic, caretaking, people-pleasing, passive-submissive, codependent, passive-aggressive, and sometimes narcissistic or aggressive. They often describe feelings of having to hide their own loneliness and misery because someone has to keep your life under control. They want to be nurtured and healed, but they believe they have to hide those vulnerabilities and sacrifice themselves in a type of martyrdom for your inner system. The more competent and efficient they become, the more your system relies on them, and the more they become overwhelmed with their responsibilities and power. They come to believe that they alone are responsible for any success and safety you have experienced, and increasingly lose trust in the leadership of the self. Let's take a moment to reflect on what I have just shared with you. Are you sensing those manager parts right now? Are you feeling attacked, called out, criticized, ambivalent, resistant, denying, justifying, rationalizing? You can pause here or stop watching. We can talk about it, or if you're not my client, you can talk to someone else. You can talk to a professional. For my clients, please bring any questions, comments, concerns, and/or philosophical rebuttals to your next session. If you're still watching, let's talk about each type of manager protector. I will have other videos for further exploration of each type of manager in more detail. This is just a quick summary of each, because there are so many and each one is unique, complex, and complicated. One of the most common managers for many people is their inner critic. The inner critic is our critical and judgmental part. This part both internalizes shame and externalizes blame. They continually find fault with themselves and other people and the world. They are discontent, complaining, restless, and look down on most things, the extreme pessimist. They are intensely frustrated that our own lives and others do not match our expectations and meet our high standards. They can be intense and vicious toward others and ourselves. They will attempt to change an objective shared reality to meet the unrealistic version of a reality they desire. This part uses harsh judgments, complaints, negativity, nagging, nitpicking, and/or character assassinations. This part says things like, "No one likes you, you are unlovable. You're not good enough, you are worthless. You're going to just fail again. Why do you bother?" And so on and so on. It is often aggressive and demeaning. They use all manner of prejudices that involve othering to help us feel acceptable, included, safe, and important. Depending on the individual's amount of self-energy, they can be racist, sexist, homophobic, transphobic, misogynist, xenophobic, ageist, classist, and ableist. Please remember, your parts have a positive intent even if their actions on your behalf are problematic. Also, my professional and personal value is that intent does not mitigate impact. The work needed to address some of the issues I just mentioned are well beyond the scope of this video. but please keep an eye out for future videos when I will discuss those all-important issues. The managerial inner critics are the ad hoc continual improvement committee in our internal system. They are relentlessly vigilant, critical, often humorless, and usually unpopular with other parts in the system. When turned inward, this part guilts, skewers, shames, demeans, and condemns us. We can be at this managerial part's mercy when this part blends with self and takes us over. This part may have been inherited from our parents, also known as family legacy burdens. One of the negative thinking patterns associated with this part might be labeling with negative connotation. Critical or judging parts can become too strong in our systems, possibly because of childhood experiences when we were learning what we should and shouldn't do, according to our parents' values and social norms. Taking in our parents' admonitions about what is permissible and what is not. We gradually develop our own inner judgment parts that remind us of the social rules of our family and community. It is, of course, vital that we develop these parts. For later, they will help us learn how to be successful within our social and community context. It is, however, easy for our system to get out of balance in this process. A complicating factor is genetics, and that our neurological and biological predisposition causes each of us to learn differently, depending upon the temperament we were born with. The difference between the introverted and the extroverted child is a good example. One effect of this temperamental difference is that introverts are much more reactive to external stimuli, such as the stern voice of the parent. If we apply that difference to the process of developing our inner critics and judges, we find this temperamental difference can have a strong impact. We can now move on to the next managerial part. The anxious worrier sentry. The part of us that keeps us fearful, anxious, and worried. The sentry feels in constant jeopardy, is on continuous alert for danger, turns molehills into mountains, and flashes worst-case scenarios in front of us while contemplating risks versus benefits. One of the many outward signs of this part is our all-or-nothing, catastrophizing, maximizing, negative thought patterns, or cognitive distortions. This is one way that IFS concepts overlap with cognitive behavioral therapy, or CBT, concepts. Worried parts can become so extreme that they make day-to-day functioning very difficult and uncomfortable. These parts want to anticipate and/or delay negative surprises. They want to be sure we don't get hurt and we don't fail. They want to be sure we're not oblivious or naive and innocent. They are anticipatory, often very physical, hard to ignore, alarmed about imaginary catastrophes, and full of warnings. Worrying can take up a lot of mental energy. The worrying and anxious part prevents other parts from being present, even though these other parts are needed to judge what is a true danger. These anxious parts can also prevent useful managers from making a plan that will help us cope with possible problems. In its functional form, the part that worries can look ahead and warn us of possible dangers. This can activate the needed parts, but it doesn't exhaust the entire system and keep us awake at night. And now we'll move on to the next managerial part. The denial manager distorts perceptions to keep you from seeing and responding to risky feedback. In the context of internal family systems, denial as a manager part would function as a protective mechanism that helps prevent the person from experiencing overwhelming emotions or confronting distressing truths. Like all manager parts, the purpose of denial is to maintain control and keep the internal system stable by preventing exiled emotions such as fear, shame, or grief from surfacing. Denial works by keeping the person's awareness away from painful or threatening realities, allowing them to continue functioning in their daily life without being emotionally overwhelmed. Denial might manifest in various ways, such as minimizing the impact of difficult situations, avoiding acknowledgement of traumatic experiences, or rationalizing away problematic behaviors. As a visual concept, denial could even be projected in the subconscious as a wall the denial parts put up to keep exiled painful truths and memories from escaping. Denial's primary goal is to shield the person from emotional pain or vulnerability by creating a psychological barrier between them and their exiled parts. For example, a person may deny the severity of an addiction or refuse to acknowledge the emotional impact of a past trauma, because facing those realities could trigger feelings of deep distress. In IFS, denial would be seen as a well-intentioned but sometimes rigid or maladaptive part. Although it is trying to protect the individual, denial can also keep them stuck by preventing growth, healing, or necessary change. The aim in IFS therapy is not to eliminate the denial part, but to help it relax by allowing the self to take the lead, enabling the individual to safely approach and heal the underlying pain that the denial is working so hard to avoid. By understanding denial as a manager part, IFS emphasizes the compassionate view that all parts, even those that may seem harmful or counterproductive, are ultimately trying to protect the individual from emotional harm. The goal is to build a relationship with the denial part, help it feel understood, and allow it to trust that the self can handle the emotions and experiences it is trying to protect against. Now we can keep going on to the next part. Let's talk about the compliant, constantly connected, caretaking, people-pleasing manager. The people pleaser and caretaker, a part common in trauma survivors, people who were abused or neglected, makes them always sacrifice their own needs so as to focus on and care for others' needs. This part is likely to criticize you for being selfish if you ever assert yourself. The people-pleasing parts try to keep us connected and in the loop. They often make us think of the welfare of others before letting us take care of ourselves. The people pleasers and caretakers are the ones that answer work phone calls, emails, and texts during their downtime. They answer calls and texts from friends at 3 a.m. in the morning. They prefer to let other people in a group of friends or family choose a restaurant even if they don't particularly agree to the choice and won't speak up to mention their preference. This is also the extreme version of the primary language and sign of affection, service to others. It is also one of the principles in the 12-step recovery model. I will have a whole series of longer videos with a video for each of the different manager roles and personalities, so we can move on to the next manager. This next manager is controversial and sensitive. You may want to pause the video here for a moment to reflect on the information I've already shared with you. When you're ready, I will move on. Okay. Now let's talk about the narcissist managerial part. This part is overly concerned with physical appearance, prestige, power, status, and influence. This part is self-aggrandizing, grandiose, delusional, feels entitled, feels better than others, and somehow feels that the rules of society don't apply to them given their elevated status. This part keeps us focused on how we look to others, how the world perceives us as strong, competent, in control at all times, over ourselves and everyone around us. They want us to have attention, approval, safety, and love. They do things like criticize our looks, invite others to criticize our looks, encourage us to go shopping, fantasize ideal scenarios, warn us about negative scenarios, obsess over clothing and material goods, and haunt the mirror. This entitled part encourages you to take whatever you desire, no matter who is wronged by the action. People who identify as male, men, are often socialized to rely on this manager. The full extent of this part is complicated and complex and outside the scope of this video. Just remember, there are no bad parts, just parts. This part is most likely trying to protect you from shame, guilt, ridicule, humiliation, rejection, neglect, loneliness, and failure. This part usually sees vulnerability, empathy, and compassion as a weakness or character flaw. However, this part can be productive and helpful when it is not blended with self in extreme ways. Taking a deep breath, knowing that segment of this video might have been triggering, whether you are a survivor of a relationship with a person with narcissist parts, or you might be struggling with accepting your narcissist manager parts, I encourage you to reach out for help. Once again, I just want to remind you, if you are my client, please bring questions, comments, concerns, and/or rebuttals to your next session. Inviting you to continue on if you feel strong enough in self-led default mode. Now let's talk about the gatekeeper. This part uses stonewalling, distancing, isolation, and cutting off in relationships as a defensive mechanism. This is another part that is your intimacy protector, keeping you from vulnerability out of a fear of abandonment, rejection, and neglect. These parts manage and regulate closeness in relationships to protect us from being too vulnerable and getting hurt. They can manifest as codependence, dependency, personality disorders, and reactive attachment patterns. They do things like cultivate an angry edge that keeps us from wanting to be close to anyone and vice versa. Act needy and overly attached, act overly sexual, act disinterested, act sleepy, act bored and disengaged. Daydream when someone else is talking. Form alliances with parts who focus on food or alcohol in social settings. And focus on electronic gadgets while their people are engaging in face-to-face communication with us. Let's keep going. The next part I'll discuss, again, might be triggering, taking your time, pausing if you need it. Now let's discuss the internal systems food managers, and could also be seen as our inner nutrition planning coach. The IFS model offers a unique lens through which to understand the complex relationships individuals have with food, exercise, body image, body weight, and self-perception. Central to this model are the concepts of managerial parts that carry out specific roles to protect and manage emotional well-being. This part of the video delves into the role of food manager parts, their interaction with other parts like food firefighter parts, and how these internal dynamics relate to behaviors often associated with eating disorders. Food manager parts are manager parts that focus specifically on controlling eating behaviors, body image, and weight. Their primary goal is to prevent emotional pain by exerting strict control over food intake and physical appearance. These parts may manifest as obsessive calorie counting, meticulously tracking food intake to maintain a sense of control, even after periods of weakness, dizziness, and lightheadedness, and possible malnutrition. Excessive exercising, overworking the body to achieve or maintain a certain physique, sometimes even after exhaustion or injury. Body image obsession, a constant preoccupation with perceived flaws in appearance, sometimes to the point of body dysmorphia. Let's turn our attention toward how food managers relate to other parts within the system, as it relates to interaction with exiles. Food manager parts often suppress exiled parts that carry feelings of unworthiness or shame related to body image or past experiences. Let's contrast them with food firefighter parts. While food manager parts seek control, food firefighter parts may engage in binge eating or impulsive consumption as a way to quickly soothe emotional distress. The food manager and the food firefighter can be in direct conflict, leading to a cycle of restriction and overindulgence. Food firefighter parts aim to divert attention from emotional pain through immediate gratification. This might involve the following behaviors. Binge eating, consuming large amounts of food in a short period, emotional eating, eating in response to feelings rather than hunger, which could include boredom eating. When comparing food manager parts and food firefighter parts, the goals of each are different. While manager parts focus on prevention and control, firefighter parts are about reaction and relief. The behaviors of each are different. Managers may restrict food intake, whereas firefighters may overconsume. The physical and emotional impacts are significant. The actions of firefighter parts can trigger manager parts to tighten control, creating a harmful cycle. When the strategies of food manager and firefighter parts become extreme, they may be recognized clinically as eating disorders. Some common eating disorders include anorexia, which is characterized by restricted food intake and intense fear of gaining weight. Bulimia, which involves cycles of binge eating followed by compensatory behaviors like purging. And binge eating, which includes recurrent episodes of eating large quantities of food without subsequent purging behaviors. Again, I want to emphasize this topic can be triggering, and I want to hold that space for you. Also know that there are very serious risks associated with eating disorders. Let's talk about each risk briefly. Physical health risks include malnutrition, tooth decay, organ damage, bone density changes, hormone imbalances, and electrolyte imbalances. Mental health risks include an increased risk of anxiety, depression, psychosis, and suicidal ideation. Quality of life risks include social isolation and impaired functioning in daily activities. The importance of professional treatment cannot be overemphasized. Addressing eating behaviors in therapy requires sensitivity and a focus on client safety. Therapists should adhere to the following ethical guidelines. Therapists should prioritize their client's safety, assess for immediate health risks, and refer their client to medical professionals and/or nutritional clinics when necessary. Therapists should create a safe, trusting, and supportive environment. Encourage open dialogue without fear, shame, or judgment. Therapists can integrate IFS therapy parts work into the sessions. Use IFS techniques to understand and harmonize the relationships between manager, firefighter, and exile parts. I want to also provide a warning for therapists. Avoid triggers. Be cautious not to inadvertently encourage harmful behaviors. Stay informed. Keep updated on best practices for treating eating disorders. Collaborate with other professionals. Work with dietitians, physicians, and psychiatrists to provide comprehensive coordinated care. To conclude this section of the video about food parts, understanding food manager parts within the IFS therapy model offers valuable insights into the internal conflicts that contribute to eating behaviors and disorders. By recognizing the roles these parts play, individuals and therapists can work together to promote healing and establish healthier relationships with food and self-image. Both the client and clinician should approach therapy with compassion and prioritize the client's safety above all else. Let's look at the addict parts, managers that attempt to regulate neurotransmitters in a variety of ways. The human psyche is a complex tapestry of thoughts, emotions, and behaviors, often woven together in intricate patterns that can both protect and hinder us. Within the internal family systems model, proactive manager parts play a crucial role in maintaining our day-to-day functioning. Yet, when these manager parts turn to addictive behaviors or substances, the internal balance can shift dramatically, leading to patterns of addiction or dependence that affect the entire system. Manager parts are the diligent overseers of our internal world. They strive to keep us organized, productive, and safe from harm by anticipating potential threats and implementing strategies to avoid them. In essence, they work proactively to prevent pain or discomfort. However, when faced with overwhelming stress, trauma, or unresolved emotional wounds, some manager parts may adopt maladaptive coping mechanisms. They might turn to drugs, alcohol, tobacco, nicotine, caffeine, energy drinks, compulsive shopping, gambling, video games, sexual activities, excessive exercise, or unhealthy engagement with technology or social media, all as a means to avoid discomfort, feeling stress, by proactively numbing or to maintain control of the emotional environment. These addictive behaviors serve a protective function from the manager's perspective. By engaging in substance use or other compulsive activities, they attempt to suppress or distract from the painful emotions carried by exiled parts, those vulnerable aspects of ourselves burdened with fear, shame, or hurt. The manager believes that by keeping these exiles quiet, it can preserve the stability of the system. However, this approach often leads to a cycle of dependence, as the temporary relief provided by the addictive behavior reinforces its continued use. In contrast, reactive firefighter parts operate differently within the IFS framework. While managers work proactively to prevent distress, firefighters act impulsively in response to emotional crises. When intense feelings break through the manager's defenses, firefighters rush in to extinguish the emotional flames by any means necessary, often resorting to the same addictive behaviors as the managers. However, their actions are reactive rather than preventative. This distinction is crucial in understanding how different parts relate to addictive behaviors and how they influence one another. The interplay between addicted manager parts and firefighter parts can create a turbulent internal environment. Managers may become frustrated with firefighters for their impulsivity, while firefighters may resent managers for suppressing emotions. Both, however, are attempting to protect the system, albeit in opposing ways. This internal conflict can exacerbate feelings of shame, guilt, or helplessness, further entrenching the cycle of addiction. These internal dynamics often manifest externally as behaviors pathologized by society and the medical community as chemical dependence, addiction, or substance use disorders. Substance use disorders encompass a range of conditions characterized by an unhealthy pattern of using substances such as alcohol, prescription medications, or illicit drugs that leads to significant impairment or distress. The risks associated with these disorders are profound, including physical health deterioration, mental health challenges, strained relationships, legal issues, and in severe cases, overdose or death. Understanding the types of substance use disorders is essential for recognizing how they may be rooted in the internal struggles of our parts. For instance, alcohol use disorder involves the excessive consumption of alcohol despite negative consequences, often used by parts to dull emotional pain. Opioid use disorder might develop when parts seek powerful relief from unbearable feelings, leading to dependence on prescription painkillers or illicit opioids. Behavioral addictions, such as gambling or compulsive internet use, follow similar patterns where parts engage in activities that provide temporary escape or control. In therapy, addressing these addictive behaviors requires a delicate and compassionate harm reduction approach. It's imperative to treat addiction seriously, always prioritizing the client's safety. This means being vigilant about the risks of overdose, the potential need for medical intervention, and the importance of professional support during detoxification or withdrawal processes. Therapists must work collaboratively with clients to explore the protective intentions of their manager and firefighter parts, helping them find healthier strategies to meet their needs without resorting to harmful behaviors. One valuable resource for individuals struggling with addiction is participation in 12-step mutual self-help fellowships, such as Alcoholics Anonymous or Narcotics Anonymous. These groups provide a supportive community where members can share experiences, offer encouragement, and learn from others who have faced similar challenges. The fellowship can complement therapeutic work by reinforcing accountability, fostering connection, and promoting personal growth within a structured program of recovery. Ultimately, navigating addiction within the IFS model involves understanding and healing the relationships between our parts. By recognizing the roles that addicted manager and firefighter parts play, we can begin to address the underlying pain driving these behaviors. Through compassionate self-exploration, professional support, and community resources, it's possible to break the cycle of addiction and cultivate a more harmonious internal system. This journey requires patience and courage, but it offers the promise of profound healing and a renewed sense of self. Let's now review what I call the woo-woo hippie parts. This part uses spirituality in all its manifestations, mindfulness, meditation, and pseudoscientific practices to bypass threatening feelings, fill a sense of emptiness, or as a facsimile for dissociating. They encourage us to disconnect from all news, thoughts, and feelings, dissociate, avoid all the chaos and pain and suffering in the external world, and keep our mental processes abstract or vague. They keep us isolated and locked in echo chambers. They distract us from emotional pain with hyper-focusing or hypo-focusing. They encourage us to be stoic and to think instead of feel. They want us locked up in logical mind and fixated on a healing and growth mindset to the detriment of sensing and feeling necessary and unavoidable pain and suffering. These proactive manager parts often employ spirituality and pseudoscience as tools for coping. While these practices can and do provide comfort for many people in the extreme form, they may also lead to avoidance and denial of reality, affecting overall well-being. Spiritual manager parts may gravitate toward practices like prayer, meditation, yoga, mindfulness, and alternative therapies such as Reiki and acupuncture. These activities can offer a sense of peace and control, aligning with the manager's goal of preventing distress. Tools like crystals, singing bowls, astrology, witchcraft, and manifestation rituals become means to navigate life's uncertainties. While spiritual practices can be beneficial, they may also serve as a veil over unresolved issues. The reliance on pseudoscience and magical thinking can lead to avoidance of reality, where the manager part denies tangible problems in favor of spiritual solutions. Similar to the part that uses denial as a means to avoid confronting and healing the pain of the past. This behavior parallels that of reactive firefighter parts, which employ impulsive actions to extinguish emotional pain, such as substance abuse or self-harm. Both strategies aim to protect the self, but can hinder genuine healing. The spiritual manager's methods can create increased tension with exiled parts, those harboring deep-seated fears and traumas. By focusing on spiritual bypassing, the manager may suppress these exiles even more, preventing them from expressing their needs. This internal dynamic can lead to increased inner conflict as the exiles push for acknowledgement, acceptance, healing, and care, while the manager reinforces denial. Engaging heavily in spiritual and pseudoscientific practices may attract diagnostic labels like religiosity, psychosis, mania, grandiosity, delusional, or magical thinking. Mental health professionals might pathologize these behaviors, viewing them as signs of underlying disorders rather than coping mechanisms. This stigmatization can further isolate individuals, discouraging them from seeking help. The manager's anti-scientific beliefs can have tangible consequences. Refusal to take medications, wear masks, get vaccinations, or attend regular medical checkups can jeopardize physical health. Nutritional choices influenced by pseudoscientific diets may lead to deficiencies. Socially, these beliefs can strain relationships, as others may find it challenging to engage with someone denying empirical realities. For those guided by spiritual manager parts, finding a balance is crucial. Integrating evidence-based practices with spiritual beliefs can enhance well-being without sacrificing reality. Mindfulness and meditation, for instance, are spiritual practices supported by scientific research. Acknowledging the protective intent of the manager while addressing the needs of exiled parts can lead to more holistic healing. Let's discover more about the inner executive, the power broker, the controller, leader, and captain of the ship, one of the many parts that act like self at times. Often there is a part of you that tries to maintain control of all your relationships or situations, afraid that the smallest slight or frightening surprise might activate one of your young hurt parts. This manager may be highly intellectual and effective at solving problems, but is also obsessed with pushing away all feelings. This part is often referred to as the controller or something similar. These manager parts correlate closely with striving parts and success-driven parts, which push the individual toward achievement and recognition. The appearance parts focus on maintaining a certain image, ensuring that vulnerabilities remain hidden behind a facade of confidence and competence. At times, these can evolve into narcissistic parts, where self-image becomes paramount, and the needs or feelings of others are overshadowed by personal ambition. While manager parts work proactively, IFS also identifies firefighter parts, reactive elements that emerge in response to emotional distress. The bossy CEO manager parts can closely relate to aggressive, confrontational, and angry firefighter parts. When the carefully constructed plans of the managers are threatened, these firefighters leap into action to quash any emerging discomfort, often through forceful means. These aggressive firefighters differ from other reactive firefighters that might resort to numbing behaviors like substance abuse or distraction. Instead, they confront challenges head-on using anger, intimidation, or confrontation as tools to restore equilibrium. The synergy between the controlling managers and aggressive firefighters creates a cycle where control is maintained not just through planning, but also through dominance and assertiveness. They do things like keep vulnerability out of sight at all costs, blame vulnerable parts for getting us hurt, and attacking and/or shaming other people who display vulnerability. These executive leadership parts exist in people from all walks of life. You don't have to look far to see this behavior play out in politics, corporate boardrooms, workplaces, military, law enforcement, criminal justice, schoolyards, gangs, and even in prisons between incarcerated people. I'm not saying these parts are good or bad. I hope you're understanding. When the parts are not blended with self and self stays in the lead, these parts can be extremely helpful and productive. It is when they take their role too seriously and resort to extreme behaviors that they can sometimes cause us incredible distress and problems in our lives. At the heart of this internal system lie the exiled parts, fragments of the self that carry memories and emotions too painful to face directly. These include feelings of disrespect, regret, insecurity, inadequacy, shame, and failure. The relentless drive of the manager parts and the aggressive interventions of the firefighters often serve to keep these exiles buried. The overbearing behaviors of the manager and firefighter parts can be seen as protective mechanisms, shielding the individual from the raw pain of these exiled emotions. However, this suppression can lead to internal tension and external dysfunction, as the unresolved wounds continue to influence thoughts and behaviors from the shadows. The traits exhibited by these manager parts are often pathologized in society as type A personalities. Characterized by competitiveness, urgency, aggression, and a constant drive for achievement, type A behaviors reflect the extreme ends of the manager and firefighter roles. While these traits can lead to success, they may also result in stress-related health issues and strained relationships. Understanding these behaviors through the IFS model offers a compassionate perspective, recognizing that beneath the driven exterior lies a protective intent, albeit one that may be misguided or overbearing. The beliefs and motives of these parts are rooted in a desire to protect the self from vulnerability and pain. The choices and actions of the internal executive manager significantly affect not only the individual, but also their interactions with others. The relentless pursuit of control and success can lead to strained relationships, as colleagues, friends, or family members may feel overlooked or dominated. The lack of vulnerability and openness can create barriers to genuine connection and understanding. Moreover, the internal pressure exerted by these parts can lead to burnout, anxiety, and a disconnect from one's authentic self. The suppression of exiled parts prevents healing and integration, perpetuating a cycle of overcompensation and reactive behavior. IFS therapy aims to bring balance to this internal system by fostering communication and harmony among the parts. By acknowledging and validating the fears and needs of the manager and firefighter parts, individuals can begin to address the underlying wounds of the exiles. Cultivating self-compassion and self-leadership allows for a more integrated personality, where ambition and drive are balanced with empathy and authenticity. Recognizing that the controlling behaviors are protective in nature opens the door to healing the deep-seated insecurities and shame that fuel them. Now let's talk about a part similar to the inner executive, the rock star, an extroverted, success-focused, validation-seeking, flamboyant, gregarious, and grandiose part. These protectors want us to become famous, rich, or successful, to feel admired and never feel rejected. They promote a grandiose sense of our value inside and interpersonally to counter the feelings of worthlessness carried by our exiles and the shaming of our inner critics. They promote the idea that failure is terrible and deny mistakes or failure. They might dismiss others' feelings, dominate conversations, or react aggressively to criticism. This combination of charm and arrogance can be both alluring and alienating, affecting personal and professional relationships. They punish others, children, subordinates, students, and so on, for making mistakes or failing. They avoid apologizing as it appears as vulnerability or weakness. These manager parts closely align with striving and success-driven parts, who relentlessly pursue achievement and recognition. Appearance parts focus on maintaining an image that commands respect and admiration, often emphasizing physical attractiveness or social status. Narcissistic parts elevate self-importance to a defining trait, seeking validation and often disregarding others' needs. The interplay among these parts creates a persona fixated on success and external validation. They drive individuals to set high standards and push boundaries, sometimes leading to remarkable accomplishments. However, this relentless pursuit can also result in stress, burnout, and strained relationships, as the needs and feelings of others are overshadowed by self-centered goals. The rockstar firefighter parts are reactive subpersonalities that emerge to extinguish overwhelming emotions, often through impulsive or aggressive behaviors. The rockstar manager parts, with their confrontational and angry tendencies, share a close relationship with aggressive firefighter parts. When their status is threatened or when they face failure, these managers may call for aid from or activate firefighter parts to protect their ego and suppress vulnerable feelings. For instance, a manager part might respond to criticism with hostility, deflecting attention from insecurities. This aggressive stance serves as a defense mechanism, shielding the individual from the pain of inadequacy or shame. Unlike reactive firefighter parts that act impulsively in the face of immediate distress, these manager-related firefighters are strategic, using aggression to maintain control and authority. Beneath the grandiose exterior of these manager parts lie exiled parts carrying deep-seated memories of disrespect, regret, insecurity, inadequacy, shame, and failure. These vulnerable parts have been suppressed to protect the individual from emotional pain. The rockstar manager's domineering behaviors are, in essence, a protective shield against these uncomfortable feelings. The fear of re-experiencing past hurts drives the manager to overcompensate through arrogance and control. By dominating their environment and seeking constant validation, they attempt to validate their worth and keep exiled emotions at bay. However, this suppression can lead to internal conflict and emotional exhaustion, as the unresolved issues of the exiled parts continue to influence behavior subconsciously. The behaviors, beliefs, and motives of these manager parts often align with characteristics of a type A personality: competitive, driven, impatient, and prone to aggression. While such traits can contribute to success, they are frequently pathologized due to their association with stress-related health issues and interpersonal difficulties. These manager parts perpetuate a cycle of high expectations and self-imposed pressure. Their inability to relax or accept imperfection can lead to anxiety and a diminished quality of life. Additionally, their interactions may suffer as they prioritize personal achievement over collaboration and empathy, potentially resulting in isolation or conflict. The choices and decisions driven by these manager parts significantly affect the individual's engagement with others. Their need for control and recognition can hinder authentic connections, as relationships may become transactional or superficial. Others might perceive them as stuck up, unapproachable, or insensitive, creating barriers to meaningful interactions. Moreover, the internal focus on maintaining a grandiose self-image can limit personal growth. By avoiding vulnerability and suppressing exiled parts, the individual misses opportunities for insight, self-awareness, healing, and self-understanding. This rigid self-concept prevents the integration of all parts, which is essential for achieving inner harmony and emotional well-being. Okay, now let's switch gears and head in the opposite direction and get to know the mouse part. In the intricate tapestry of human psychology, our personalities are often a mosaic of diverse parts that influence our thoughts, feelings, and behaviors. Among these, the shy, introverted, quiet, demure, passive, submissive, and sometimes dependent or codependent parts, aptly likened to a tiny house mouse, play a subtle yet profound role in our lives. The mouse part can keep us in the shadows, rendering us the perennial wallflowers or bench warmers of our own stories. They say things like, "Don't rock the boat," or "It's not that important, don't say anything," or "It's not a big deal, suck it up and be the bigger person." Now I'm going to quickly review the essence of the mouse part, their correlation with more aggressive counterparts, their relationship with reactive firefighter parts, and their connection to exiled parts harboring pain from the past. This manager part embodies the role through avoidance and withdrawal. They steer us away from potential conflicts or rejections by keeping us quiet and unobtrusive. These parts often manifest as self-effacing behaviors, such as a reluctance to voice opinions, hesitance in asserting needs, and a tendency to acquiesce to others. While their intent is protective, aiming to shield us from hurt or disappointment, they inadvertently suppress our authentic selves, needs, and desires. They keep us invisible, safely under the radar. They promote the feeling that attention is dangerous and avoid letting us be seen. They discourage ambition and refuse to strive for any goal. They avoid letting us feel good about accomplishments and tell us that others will be hurt by our success. They manifest as an inability to set boundaries and be assertive to ask for what we need. One type of mouse part, the passive pessimist, tries to avoid interpersonal risk, particularly situations that could arouse anger, sexuality, or fear. This can make you totally apathetic and withdrawn, so that you do not try to get close to anyone. This part erodes your self-confidence and sabotages performance, so that you won't have the courage to pursue goals. It may seek out and highlight flaws in an object of desire, in order to undermine attempts to obtain it. In people who have been severely abused, this part can become an inner terrorist, taking on qualities of the abuser and scaring the exiles into making the person even more withdrawn. Interestingly, the mouse manager parts are closely linked to their seemingly opposite counterparts, the aggressive, irritable, or passive-aggressive parts. When the quiet suppression becomes unbearable, it can give rise to frustration and resentment. The inability to express needs openly may lead to indirect expressions of anger or sudden outbursts. Passive-aggressive behaviors, such as subtle sabotage or sarcasm, can emerge as a compromise between the desire to avoid confrontation and the need to address unmet needs. Thus, the mouse and aggressive parts exist on a spectrum, both attempting to navigate the complex terrain of interpersonal relationships and self-preservation. A hallmark of the mouse manager part is their difficulty in advocating for themselves. They often struggle to make requests for their needs and desires, fearing rejection or disapproval. This self-silencing can lead to a cycle of unmet needs, diminished self-worth, and increased dependency on others for validation. By not asserting themselves, individuals may become background figures in their own lives. They might watch opportunities pass by, not because of a lack of desire, but due to an internal barrier against stepping forward. This passivity can hinder personal growth and fulfillment. Firefighters are reactive protectors that emerge in response to emotional distress, often employing impulsive or extreme behaviors to douse the internal flames of pain. The mouse aims to prevent these fires from igniting by avoiding triggers. However, when their strategies fail and emotional pain surfaces, firefighter parts may activate. For instance, after prolonged suppression, an individual might engage in overeating, substance use, or other compulsive behaviors to cope, hallmarks of firefighter intervention. Thus, while the manager parts work proactively, the firefighter parts reactively handle the same underlying issues. At the core of these dynamics are the exiled parts, fragments of the self that carry painful memories and emotions from past experiences, often rooted in childhood. These exiles may harbor feelings of unworthiness, abandonment, or shame. The mouse strives to keep these exiles hidden, fearing that exposing them will lead to overwhelming pain or rejection. The behaviors of the mouse, withdrawal, passivity, and submission, serve as protective mechanisms to prevent the resurfacing of these buried wounds. However, this avoidance can impede healing as unaddressed exiles continue to influence thoughts and behaviors from the shadows. The traits exhibited by mouse manager parts often align with clinical descriptions of dependent personality disorder, avoidant attachment patterns, or codependent personalities. Dependency involves a pervasive need to be taken care of, leading to submissive and clinging behaviors. Codependency extends this concept to include an excessive reliance on relationships for self-worth and identity. While these labels can help identify patterns, they also risk pathologizing natural protective responses to past traumas. It's crucial to approach these parts with compassion and understanding, recognizing that their behaviors stem from a place of self-preservation. The decisions and interactions shaped by the mouse significantly affect an individual's life. By avoiding assertiveness, one might miss out on career advancements, fulfilling relationships, or personal achievements. The tendency to prioritize others' needs can lead to imbalance and resentment in relationships. Moreover, this dynamic can perpetuate a cycle where others come to expect passivity, further entrenching the individual in the background. Breaking free requires self-awareness, courage to face exiled parts, and developing healthier strategies for self-expression and boundary setting. Understanding and integrating the mousy manager parts is a journey towards self-compassion and authenticity. Acknowledging their protective intentions allows us to appreciate their role, while gently encouraging them to adopt new, more adaptive behaviors. Therapeutic approaches like IFS emphasize internal dialogue, engaging with these parts to heal exiles and reduce the need for extreme protective measures. By fostering this inner harmony, individuals can step out of the shadows, advocate for themselves, and lead more fulfilling lives. Our next manager in this lesson is the temper tantrum, the manager with a short fuse and quick temper. This part-time manager, part-time firefighter, is irritable, throws fits, has temper tantrums, gets frustrated and angry easily, not unlike a disgruntled child denied a favorite toy. and possibly guards and assists an exiled aggressive protector, a deep or hidden part of ourselves that carries unresolved pain or trauma. This part who felt angry at mistreatment are often young and trapped in the past. They may have stepped forward to protect another young part and been exiled because their anger was unsafe. They often continue to be treated like kryptonite in the system because anger itself is viewed as a perpetrator behavior. They are smoldering, resentful, and feel slighted. They interrupt others and push back aggressively. They easily express their disdain and explode at the slightest provocation, releasing the other firefighter half. They can form alliances with other aggressive protectors. This irritable manager closely correlates with other aggressive or passive-aggressive internal parts. While the temper tantrum manager overtly expresses frustration, these related parts might manifest as sarcasm, subtle digs, or a simmering resentment beneath the surface. Together, they form a network of defenses that react to perceived threats or unmet needs. The temper tantrum manager advocates for its needs and desires in ways that often disregard others. It demands attention, pushes for immediate gratification, and can be dismissive of the feelings and needs of those around us. This lack of mutual respect can strain relationships and create cycles of conflict. When dominated by this irritable part, individuals may find themselves constantly on edge, harboring resentment without fully understanding why. Small annoyances become significant issues, and patience wears thin. This state not only affects personal well-being, but also impacts how one interacts with the world. In internal family systems theory, firefighter parts are those that react impulsively to extinguish emotional pain, often through drastic measures. The temper tantrum manager shares similarities with these parts, but differs in its approach. While firefighters might engage in behaviors like substance abuse or escapism to numb feelings, the temper tantrum manager confronts discomfort head-on, albeit in a volatile manner. Both the temper tantrum manager and reactive temper tantrum firefighters respond to internal distress, but their methods diverge. Firefighters might seek to distract or suppress emotions, whereas the temper tantrum manager externalizes them. Understanding this distinction can help in identifying coping mechanisms and seeking healthier alternatives. At the core of these behaviors often lie exiled parts carrying painful memories from the past, particularly from childhood. The temper tantrum manager may act as a guardian to these vulnerable parts, attempting to protect them by keeping potential threats at bay through aggression or irritability. Unaddressed childhood wounds can thus manifest as present-day reactions that seem disproportionate to the situation. The actions and beliefs of the temper tantrum manager can sometimes be pathologized, labeled as traits of antisocial, borderline, or narcissistic personality disorders. While these labels have clinical significance, it's crucial to approach them with nuance. Recognizing these behaviors as parts of a complex internal system allows for a more compassionate understanding rather than reducing individuals to diagnostic categories. The decisions and engagements driven by the temper tantrum manager can have profound effects on one's life. Impulsive reactions may lead to regrettable choices, strained relationships, and missed opportunities for genuine connection. By becoming aware of this part, individuals can begin to make conscious choices that align more closely with their true selves and values. Acknowledging the presence of the temper tantrum manager is the first step toward integration. By understanding its motives and the pain it seeks to protect, one can work toward healing the underlying wounds. Techniques such as mindfulness therapy and open communication can aid in this process, leading to healthier expressions of needs and emotions. In this modern era of constant connectivity and endless to-do lists and a grind culture of always doing and rarely being, many of us grapple with avoidance, distraction, procrastination, and addictive behaviors. With technology, we now have a whole new dimension, a veritable looking glass world, into which we can fall for endless distraction. We find ourselves scrolling through social media instead of tackling that important project, or we jump from one random task to another, never fully committing to or finishing any tasks. These patterns can leave us feeling disorganized, restless, and perpetually behind schedule. But what if these behaviors are not just bad habits or character flaws? What if they are manifestations of internal manager parts trying to protect us in their own way? We are going to explore the concept of these manager parts, inner facets of ourselves that distract us through technology, addictive behaviors, and random tasks. Let me stop here just to mention neurodevelopmental disorders are serious brain-based physical abnormalities, likely due to a complex mix of genetics, experience, environment, development, family, and relationships. The ADHD part term is a metaphorical use of the disorder. It is used to describe the part's influence on one's behaviors. A person who has this part take over may not actually meet the criteria for a full diagnosis of ADHD. I want to make sure we keep these two things separated. I'll delve into how the ADHD part correlates with procrastination and demand avoidance, their relationship with reactive firefighter parts, and their connection to exiled parts carrying painful memories from our past. We'll also discuss how these internal dynamics can be misinterpreted as attention deficit hyperactivity disorder or other executive dysfunction disorders, and how understanding these parts can impact our choices, decisions, and relationships. The ADHD manager is a part that seeks stimulation and avoids boredom by pulling us toward activities like incessant phone checking, binge-watching shows, or engaging in endless, small, unimportant, or unrelated tasks. While these behaviors may seem counterproductive, this manager's primary goal is to protect us from discomfort, anxiety, or deeper emotional pain. By keeping us occupied, the distracting manager prevents us from facing tasks that might evoke feelings of inadequacy, fear of failure, or other unsettling emotions. In essence, it's guarding and assisting a firefighter part that uses substances or addictive behaviors to numb or self-soothe when those uncomfortable feelings threaten to surface. These parts make us take out our gadgets when we are at the office, when we stand in a line, when we are in unpleasant environments like airports, elevators, and busy, noisy public streets, when we are in conversation, while eating meals, while in school, at lectures, even in libraries. In short, they will take gadgets out anywhere, anytime to look at them, play with them, or work with them. This part loves streaming entertainment avoidance, distraction, and procrastination. Netflix, anyone? The human mind is engaged by stories, whether they are banal and cliched or original. Our electronic devices deliver an endless stream of visual stimulation. Words and books, music and sounds, real-life experiences, news, sports, texting, email, and fictional stories. These playful parts take us out to the movies, like watching TV, cable, or various other subscriber services. They live vicariously through movie characters and retell the stories of the shows we have just watched. They provide distorted realities and false hopes via reality TV. They make us relate to the characters depicted therein to learn, emulate, and make sense of our own life experiences. As AI becomes more advanced and more pervasive, the entertainment options and what is produced distorts our reality, beliefs, values, and perceptions of what is real and what is possible. Malevolent agents and profiteers are busy with manipulative algorithms that push reinforcement of our fears, anxieties, and in the worst cases, hate and othering into our social media feeds. The ADHD manager is closely linked with distraction, procrastination, and demand avoidance. Procrastination isn't just laziness. It's often a defense mechanism against tasks that feel overwhelming or threatening to our self-esteem. Demand avoidance surfaces when we perceive external pressures as intrusive, leading us to resist commitments or expectations. The part's behaviors work to steer us away from perceived threats, but in doing so, they can erode our focus, discipline, and motivation. We become the person who is always late, disorganized, and restless, not because we lack ambition, but because our internal managers are pulling us in different directions to protect us from underlying fears or anxieties. While both manager and firefighter parts aim to protect us, they operate differently. Manager parts are proactive, seeking to prevent distress by controlling our environment and actions. They plan, organize, and in the case of the distracting manager, proactively divert our attention to prevent exiles from escaping, or even leaking any emotions. Firefighter parts are reactive. When an exiled part's pain breaks through, such as a painful memory or intense emotion, the firefighter jumps in to quash it, often through sudden impulsive actions like substance use, overeating, self-harming, or other self-soothing behaviors. Both types of parts' actions can lead to similar outcomes: disrupted focus, strained relationships, and a sense of internal conflict. However, understanding whether a behavior stems from a manager or firefighter part can help us address the root cause more effectively. At the core of these internal dynamics are the exiled parts, fragments of ourselves that carry painful memories and emotions from past experiences, often from childhood. These exiles might hold feelings of shame, fear, rejection, or unworthiness. Because these emotions are so distressing, our manager and firefighter parts work diligently to keep them suppressed. The ADHD manager keeps us busy to prevent these painful feelings from surfacing, while the firefighter steps in to numb the pain if it does break through. This internal system, while protective, can keep us trapped in cycles of avoidance and prevent improvement, healing, growth, and functioning. The behaviors driven by the ADHD parts, avoidance, distraction, procrastination, restlessness, are often labeled as symptoms of ADHD or executive dysfunction disorders. While these diagnoses can be accurate and helpful for some, they may not apply to someone with these parts, and they may overlook the complex internal dynamics at play. By understanding the behaviors as the actions of manager and firefighter parts, we can move beyond labels and address the underlying emotional wounds. This perspective encourages self-compassion and a holistic approach to personal growth, rather than simply managing symptoms. The choices and decisions influenced by the distracting manager can significantly affect our lives. We might struggle with career advancement due to procrastination, miss out on meaningful relationships because we're always preoccupied, or feel a constant sense of dissatisfaction and restlessness. Engagement with others can also be impacted. The distracting manager might prevent us from forming deep connections, as staying on the surface feels safer. Our reliability might suffer, leading to strained relationships with friends, family, or colleagues. Recognizing the role of the distracting manager allows us to make conscious choices. We can begin to negotiate with this part, understanding its protective intentions, while finding healthier ways to address the underlying exiled parts that need healing. Awareness is the first step toward change. By identifying and understanding our internal manager and firefighter parts, we can start to unravel the protective mechanisms that no longer serve us. This process often involves self-reflection, taking time to notice when and how these parts show up in our lives. Compassionate inquiry, gently questioning the needs and fears that drive these parts. Professional support. Working with therapists or counselors familiar with internal family systems or similar models can provide guidance and support. Ultimately, the goal is not to eliminate these parts, but to integrate them, appreciating their roles while healing the exiled parts they strive to protect. This holistic approach can lead to improved focus, better relationships, and a more fulfilling life. When it comes to distraction, procrastination, or avoidant manager behaviors, these parts are often protecting exiles that hold deep-seated feelings stemming from past experiences. Here are some types of exiled parts that such managers might be protecting. The first exile might be failure and inadequacy. The exile may have lived through past experiences where attempts to succeed were met with criticism, ridicule, or punishment. This could be from overly critical parents, teachers who singled us out, or peer influences during formative years. The exile's burden is a feeling of inadequacy, incompetence, or not being good enough. By distracting or procrastinating, the manager prevents engagement in tasks where failure is possible, thus shielding the exile from re-experiencing feelings of inadequacy. The next exile might be shame and embarrassment. The exile may have lived through situations where the individual was humiliated or made to feel ashamed, perhaps in public settings or by important figures in their life. The exile's burden is a deep-seated shame, embarrassment, and a desire to hide. The ADHD manager avoids situations that could trigger these feelings by steering attention elsewhere, often through addictive behaviors or technology. The next exile might be rejection and abandonment. The exile may have lived through early experiences of neglect, abandonment, or rejection by caregivers or peers. The exile's burden is an intense fear of being left alone or of not being loved. The ADHD manager keeps the individual from forming close relationships or committing to tasks that require vulnerability, thus avoiding potential rejection. The next exile might be perfectionism and criticism. The exile may have past experiences in environments where perfection was expected and mistakes were harshly punished or criticized. The exile's burden could be the belief that they must be perfect to be worthy of love or acceptance. The ADHD manager procrastinates or avoids tasks unless perfection can be guaranteed, preventing the exile from facing criticism. The next exile might be trauma and abuse. The exile may have experienced physical, emotional, or sexual abuse that left deep psychological scars. The exile's burden might be trauma responses, fight or flight, fear, and unresolved pain. The ADHD manager distracts us from memories or triggers associated with the trauma by engaging in numbing activities or addictions. The next exile might be anxiety and overwhelm. They may have past experiences where they felt overwhelmed by responsibilities or emotions they couldn't manage. The exile's burden could be chronic anxiety, panic, or feelings of being overwhelmed. The ADHD manager avoids tasks that might induce anxiety, keeping the individual in a comfort zone of distraction. The next exile might be low self-esteem and worthlessness. The exile may have received consistent messages, verbal or nonverbal, that they are unworthy or unlovable. The exile's burden is the core beliefs of unworthiness, not good enough, and lack of self-esteem. The ADHD manager might be trying to prevent situations that might reinforce these beliefs, such as social interactions or challenging tasks, through avoidance and procrastination. The next exile might be loss and grief. The exile may have experienced significant compounded losses that were not properly grieved, such as the death of a loved one or cherished pet, the loss of a job, or the end of an important relationship. The exile's burden might be deep sadness, complex grief, and unresolved mourning. The ADHD manager keeps the individual busy with distractions to avoid confronting the pain of loss. So now, how do the ADHD managers protect these exiles? The manager parts employ strategies like distraction, procrastination, and avoidance as defense mechanisms to keep the exiled parts and their painful emotions out of conscious awareness. By doing so, they aim to maintain emotional equilibrium and prevent the individual from becoming overwhelmed by negative feelings. They use distraction, engaging in activities, excessive internet use, gaming, or social media scrolling that occupy the mind and prevent introspection. They use procrastination, delaying tasks that could trigger feelings of inadequacy or failure. They use avoidance, steering clear of situations, people, or tasks that might evoke painful memories or emotions. Now let's talk about the cycle of protection and its impact. While these manager strategies can provide short-term relief, they often lead to long-term challenges. The strategies can lead to reduced productivity. Procrastination can hinder academic or career advancement. The strategies can lead to strained relationships. Avoidance behaviors can lead to misunderstandings and distancing in personal relationships. The strategies can lead to emotional disconnection. Constant distraction prevents authentic emotional experiences and personal growth. The strategies can lead to reinforced negative beliefs. Failure to engage with challenging tasks can reinforce feelings of inadequacy or incompetence. The behaviors of these ADHD managers might lead to pathologization and misdiagnosis. The behaviors exhibited by these manager parts can resemble symptoms of attention deficit hyperactivity disorder or executive dysfunction disorders. For instance, this can manifest as inattention and distractibility, which may be seen as ADHD when it's actually a manager part avoiding painful emotions. It might manifest as hyperactivity. It could actually just be restlessness and could be a manifestation of anxiety stemming from exiled fears. It might manifest as disorganization. Difficulty in organizing tasks may result from avoidance of triggering activities. Understanding the underlying exiles can prevent misdiagnosis and lead to more effective interventions that address the root causes rather than just the symptoms. Healing, integration, and addressing these exiled parts involves the following: awareness. Recognizing the presence of manager behaviors and their protective intentions. Self-compassion. Approaching exiled parts with kindness and understanding, acknowledging their pain. Therapeutic work. Engaging in therapy, particularly IFS, to safely explore and heal exiled parts. Developing new coping strategies. Replacing avoidance with healthy coping mechanisms like mindfulness and emotional regulation skills. And building support systems. Creating a network of supportive relationships that provide safety and acceptance. Distraction, procrastination, and avoidance may not be bad habits. They could be protective strategies employed by manager parts to shield exiled parts carrying deep emotional wounds. By understanding and compassionately addressing these exiles, we can reduce the reliance on protective managers, leading to improvements in the following areas: focus and productivity. As exiles heal, the need for distraction diminishes. Relationships. Openness to vulnerability allows for deeper connections. Emotional well-being. Integration of exiled parts leads to a more harmonious internal state. And authentic engagement. Freed from the burdens of the past, individuals can engage more fully with the present. Healing is a journey that involves embracing all parts of ourselves, understanding their roles, and working towards internal harmony. Recognizing the exiled parts protected by our distraction, procrastination, and avoidance allows us to address the root causes of our behaviors and move towards a more fulfilling life. Our next manager in this lesson is the intellectual. This part intellectualizes their experiences. They can cause us to be elitist and possibly even lend us a sense of self-righteousness. This part values logic and reason above all, often at the expense of emotional depth and connection. The intellectual parts flourish in families and settings that celebrate and survive on cognitive strengths, like the child of a professor who grows up in a university town. They overthink experiences, situations, and interactions as a way of overriding or interrupting difficult feelings. They look down on people who don't rely on their thinking parts as much and help us feel special, gifted, and better than others. They value wisdom, knowledge, and career or academic achievement over vulnerability, feelings, and intuition. They can sometimes form alliances with the critics, power brokers, and appearance parts. Let's look into how this intellectual manager operates, its relationship with other parts like the firefighters, and the exiled emotions it strives to protect. The intellectual manager serves as a shield against vulnerability by keeping emotions at arm's length. By focusing on facts, data, and logical reasoning, this part avoids delving into feelings that may be painful or overwhelming. This avoidance can manifest as self-righteousness, where the individual believes their perspective is the most rational or correct, dismissing others' feelings or opinions as illogical or inferior. This part may also lead to looking down on those perceived as less intelligent. Passive-aggressive behaviors, such as subtle insults or demeaning comments, become tools to assert superiority and maintain emotional distance. The need to always be right and remain the smartest person in the room is the hallmark of this manager, reinforcing its control and preventing exposure to vulnerability. The intellectual manager strives to protect the vulnerable exiled parts by creating a barrier of logic and reason, preventing the individual from re-experiencing the associated pain. For instance, an exile might hold feelings of inadequacy stemming from childhood criticism or neglect. The intellectual manager steps in to prevent these feelings from resurfacing by projecting confidence and superiority, often through displays of intelligence and correctness. The behaviors, beliefs, values, and motives of the intellectual manager can become pathologized when they hinder personal growth and relationships. Over-reliance on intellectualization can lead to emotional disconnection, isolation, and strained relationships due to perceived arrogance or dismissiveness. Such pathologization occurs when the manager's protective strategies become maladaptive, blocking access to genuine emotional experiences and preventing healing of the exiled parts. The insistence on being right and demeaning others can create a cycle of conflict and reinforce the very insecurities the manager seeks to suppress. The choices and behaviors driven by the intellectual manager significantly affect how individuals engage with others. Relationships may suffer as the person struggles to connect on an emotional level, often leaving others feeling unheard or undervalued. The intellectual manager's dominance can also lead to internal conflicts, as other parts of the self may feel suppressed or invalidated. Furthermore, this dynamic can impede personal development. The avoidance of vulnerability prevents the processing and integration of exiled emotions, keeping the individual stuck in protective patterns rather than moving toward healing and self-acceptance. Recognizing the role of the intellectual manager is a crucial step in IFS therapy. By acknowledging this part's protective intentions, individuals can begin to build a compassionate relationship with it. This opens the door to gently accessing the exiled parts, allowing for the healing of old wounds and the integration of all aspects of the self. Therapeutic work involves helping the manager trust that it is safe to lower its defenses and that the individual can handle the underlying emotions. As this trust develops, the person can experience a fuller range of emotions, leading to more authentic connections with others and a more harmonious internal system. Our last manager in this lesson is the Joker. The Joker uses satire, sarcasm, and humor as a defense to deflect and avoid vulnerability, but paradoxically doesn't consider everything in life a joke. The Joker uses humor in all kinds of ways to set a tone and influence others. The class clown or the comedian. They can be self-deprecating. They keep others happy and engaged. They people please, entertain others, and get attention for us so we can get our needs met. They use witty banter, sarcasm, and humor to steer conversations away from uncomfortable emotions or topics. By making light of serious situations, this part keeps vulnerability at bay, ensuring that deeper feelings remain hidden. While laughter can be therapeutic, the Joker's over-reliance on humor serves as a shield against facing and processing genuine emotions. This part may crack jokes during serious discussions or deflect personal questions with humor, creating a barrier that prevents others from getting too close. The Joker values lightheartedness and may dismiss serious conversations as too heavy, thereby avoiding introspection or emotional exposure. The Joker might sometimes use humor to subtly demean or belittle others, often under the guise of teasing or sarcasm. This behavior can stem from a place of insecurity, where making others the focus of jokes reinforces a sense of superiority or control. Passive-aggressive humor becomes a tool to navigate social situations without revealing one's own vulnerabilities. The tendency to mock or trivialize others' feelings can strain relationships, as it may come across as insensitive or dismissive. The Joker's need to keep interaction superficial ensures that emotional depth is avoided, thus protecting the self from potential hurt. While managers like the Joker proactively prevent emotional distress, firefighters might engage in impulsive behaviors to numb or escape overwhelming feelings when they break through. Both the Joker and reactive firefighters aim to shield the self from pain, but differ in their methods. The Joker uses humor and wit to maintain a facade of composure, whereas firefighters might resort to actions like humiliating someone, excessive drinking, overeating, or other escapist behaviors to quickly suppress unwanted emotions. At the core of our internal system lie the exiled parts that carry deep-seated pain, shame, or trauma, often rooted in negative and stressful childhood experiences. The Joker vigilantly protects these exiled parts by keeping emotional conversations light and deflecting any probes that might unearth hidden wounds. For example, an exile might harbor feelings of abandonment from early life experiences. The Joker steps in to prevent these feelings from resurfacing by ensuring that interactions remain jovial and non-threatening. By avoiding serious discussions, the Joker keeps the exiled pain at bay. While humor is a valuable coping mechanism, the Joker's behaviors can become pathologized when they interfere with authentic emotional expression and connection. Overusing humor to deflect can lead to superficial relationships, unresolved emotional issues, and a lack of personal growth. The Joker's insistence on keeping things light may prevent meaningful conversations, causing frustration among friends and loved ones seeking deeper connections. This avoidance can reinforce isolation and prevent the healing of exiled parts that need acknowledgement and compassion. The Joker's influence on personal interactions is significant. By consistently deflecting with humor, individuals may struggle to form deep, trusting relationships. Others might perceive them as unwilling to engage sincerely, leading to misunderstandings or feelings of being unheard. Internally, the constant avoidance of vulnerability can hinder the improvement of self-awareness and emotional well-being. The Joker's dominance may suppress other parts of the self that crave authentic expression, leading to internal conflicts and a sense of emptiness or dissatisfaction. Acknowledging the Joker's role is a vital step in IFS therapy. Recognizing that this part aims to protect the system from harm opens the door to compassionately engaging with it. Therapy can help the Joker understand that it's safe to ease its defenses and that facing underlying emotions won't result in harm. Building trust with the Joker allows access to the exiled parts it guards. Gradually, individuals can explore the hidden feelings and experiences that the Joker has been shielding. This process fosters healing, enabling a more balanced and integrated self where humor becomes a joyful expression rather than a defensive tool. The journey toward embracing all parts of oneself involves appreciating the Joker's positive aspects, its ability to bring joy and laughter, while also allowing space for vulnerability and depth. By balancing humor with openness, individuals can enrich their relationships and deepen their understanding of self and their internal system. Learning to lower the Joker's defenses doesn't mean abandoning humor or joy, but rather using it playfully in a way that enhances rather than hinders emotional connections. Embracing authenticity allows for a fuller range of human experiences, leading to more meaningful interactions and personal fulfillment. This video is only one in a comprehensive series of videos I am making about IFS therapy from my integrative and holistic perspective. There are so many ways to sense our parts, identify them, relate to them, and appreciate them. There may be hundreds of different parts in any one person's internal system. It is important to remember the part's demeanor, whether the part is proactive, reactive, passive, aggressive, avoidant, or confrontational, for example, determines its intent. It is important to remember that each one has its own memories, beliefs, values, perception, emotions, thoughts, and strategies. And finally, it is important to remember that each part has a unique role in the system, that it believes it must do because no other part or self will do. There may be too many manifestations of all those factors to manage simultaneously. This video was produced by me, James Fitzgerald, a Vermont state licensed clinical mental health counselor. The video was inspired by the following authors and their books. The primary source of information were the books by Richard C. Schwartz, Internal Family Systems Therapy, and No Bad Parts. Another reference is the book by Frank Anderson, Richard Schwartz, and Martha Sweezy, Internal Family Systems Skills Training Manual. Another influential work is Jay Early's Self-Therapy, a step-by-step guide to creating wholeness and healing your inner child, using IFS. Another source of information used in this video was the IFS deck of playing cards, a tool for using the internal family systems approach to overcome problems, understand your parts, and strengthen your core self, by Dr. Roger Goddard. And finally, Bonnie Weiss and her work, Self-Therapy Workbook, an exercise book for the IFS process. I also recommend these books for you to read and work through in your own journey, either professionally or personally. That concludes this lesson on the managers. How was it to watch this long video with difficult subject topics? My hope is that you were able to absorb the information in this lesson without becoming defensive, guilty, or triggered emotionally. It is extremely important to remember that these roles taken on by your parts are not you or yourself. They are not their burdens, they are not bad or good or positive or negative. All parts should be welcomed and loved for their contribution to running the internal system, their positive intentions, not their behaviors, consequences, or outcomes.